I'm Richard Rosenfeld, a distinguished professor at SUNY Downstate Medical Center, and here's part one of my presentation on common sense medicine, timeless principles for better health. And you can see the reference to common sense coming in the center panel from Thomas Paine's address to the inhabitants of America. So I'm addressing the inhabitants of America today from SUNY Downstate in Brooklyn, the Brooklyn Bridge. I've been there almost 3 decades practicing medicine. It's a wonderful place with a long reputation of excellence. My experience also comes as a senior advisor for guidelines and measures for our National Ear, Nose, and Throat Academy, and I do quality work with many organizations around the world. So I've had some experience in addition to being a journal editor, and it's made me a bit skeptical and made me thoughtful about what are the principles that really make us healthy. So let's get into that. And we can begin with a quote from William Osler, one of the most famous physicians, who said that common sense in medical matters is rare and usually an inverse ratio to the degree of education. Think about that. The smartest doctors with the most degrees, the most specialty training, probably have the least common sense. We can look at it in this Dilbert cartoon, wow, you have a master's degree. Well, it's impressive, but I have no common sense whatsoever. Well, probably shouldn't say that on a job interview. And it's true. And for purposes of this talk, let's define common sense as really just some sound and prudent judgment or a simple perception of facts. We'll keep it simple. So let's begin. The first aspect of common sense is to watch the hands. Watch the hands of the health professional you're working with. Why? Well, to understand that, let's think about which might be a better example of common sense medicine. I'm going to show you two things here. Surgical gloves. Surgeons wear gloves. They've done it for over 100 years. And here's something unique to Brooklyn. They call it Brooklyn brownstones. You've probably seen these with the elevated stairway for the entrance. So, which is a better example of common sense in medicine? Well, I'll surprise you. If you thought it was the gloves, you're wrong. It's Brooklyn brownstones. Brooklyn brownstones came about in the 19th century for one simple reason. The primary mode of transportation was horses. And horses do a lot of something. Horses poop a lot. And when this horse excrement would accumulate in the streets, if your home or office had a ground level entrance, sanitation was poor, the rains would come down, and guess what you'd have flowing into your living room or your entryway. So the idea was to elevate the entrance to avoid any of this runoff from the horse excrement going into your house. A very good example of public health and sanitation. In contrast, surgical gloves related to William Halsted, a very famous surgeon who, interestingly enough, was quite interested in his surgical nurse, a Miss Carolyn Downing. But she had a problem. She had a dermatitis. And at the time, they were washing their hands in these solutions that were very irritative during surgery. And it was threatening her ability to remain his surgical nurse, which he was not pleased with. So Halsted commissions the Goodyear Rubber Company to make these thin gauntlets to protect her hands. And it worked so well that they were thrilled. He later married her. They were engaged and married. And other people said, that's a good idea, those surgical gloves. Nothing to do with your health, everything to do with the love story between the surgeon and his nurse. So let's think more about this issue of hands and sanitation. Let's go now to a fellow named Ignaz Semmelweis in Vienna. He was an obstetrician. He delivered babies. And at the time was very concerned about something called puerperal fever, a fever and illness that women can get in the process of childbirth, and it could be fatal. So in his hospital, let's see what happened. In the late 18th century or early 19th century, the rate of this puerperal fever, this infection, was low. 1 out of 100 people, not a big deal. All of a sudden, it started to go up, 5 or 6%. Coincidentally, the medical students and doctors started doing autopsies in the basement of the hospital, and then they come up to deliver the babies. Not the best idea in retrospect. And then there was an epidemic of this puerperal fever, up to the point where nearly 1 in 7 women got it and potentially died. And women were begging to be delivered by the midwives. because they weren't in the basement doing the autopsy. So finally, Semmelweis figured out something must be transmitted from the hands of the doctors when they come up from doing the autopsy. So he introduces this concept of washing the hands with a chlorinated lime solution, and bingo, the rates go down, and you'd think everybody was happy, but no, the medical authorities thought he was nuts. And they basically complained, we don't have time to wash our hands. What is this nonsense? So he died in effigy, and 50 years later, they finally recognized his accomplishment. Let's jump to the present, which I think is what you're concerned about. Let's go to one of the most serious places in a hospital, the intensive care units. Here's a study published in a very prominent medical journal a few years ago, where they wanted to see if doctors actually wash their hands when going into the intensive care unit, the ICU. What happened? Only half of them actually washed their hands or cleaned them before touching patients. They had an educational intervention, and it went up to a whopping 56%. Not a big difference. Turns out the doctors were far more interested in washing their hands when they left and getting the germs off of themselves, so that was about 2/3 to 3/4. Incredible in the ICU. And this is why many hospitals have said, ask your doctor if they wash their hands. It's a very simple question, but many times patients are intimidated. They don't want to ask this. They're worried about insulting their doctor. So does that mean you shouldn't ask? Well, no. There's something called nosocomial infections. Nosocomial infections are infections that your doctor and the healthcare system generously gives you. They're caused by the medical system itself. Well, next time you see your doctor, think about what's growing on that stethoscope or what's growing on that keyboard that they're now obligated to type in the medical record. It's loaded with germs, with resistant germs, pens, pencils, everything, ties. In certain countries, in the UK, for example, doctors must wear bow ties. They can't wear ties because they're too infected. And even things like watches. Now, you can't control what's on all these surfaces, but by insisting that your doctor washes their hands, you can make sure what's ever on these surfaces don't reach you. It's common sense, but uncommon action. They actually did a study looking to see, are people comfortable asking their doctors to wash their hands? And what they find out? Well, very interesting. So it turns out in the middle group there, the people between like 35 and 58, the middle-aged folks, they were not happy about it. Only a quarter or less really felt comfortable asking their doctor to wash their hands. Turns out the young and the old were far more adventurous. The young in particular could care less. Almost 3/4 of them were happy to ask, and in the elderly groups, about half. So is it still going on today? We can look to Germany, where they have an excellent healthcare system, and even in there with a national hand hygiene campaign, the overall rate of compliance of hand hygiene was just under 3/4. Turns out the nurses cared a lot more than the doctors. And again, like the other study, they washed their hands when they left, not when they entered. So it's a pretty sad state. Bottom line for you, the consumer, if you don't want all those resistant germs, some of which can be very serious, if your doctor does not go in a room and immediately perform hand hygiene, wash their hands, use the alcohol-based disinfectant, then ask them to do it in front of you. If they're hesitant or they tell you, oh, I did it before they came in, or oh, it's not important, then really proceed at your own risk because you don't know what you're going to get. And if you really want to be safe, see if they do it when they leave. That's the sign of a good doctor. So watch the hands. Now, you can't always see what people do. So here's just a quick aside on hand hygiene. If your cell phone goes dead and you need to borrow a phone, should you borrow one from some who's young, under 30, or an older person, over 45? Simple question. Well, it turns out if you ask people if they regularly use their cell phone when going to the bathroom, young folks, so they do it half the time. Older folks, however, do it only about a quarter of the time. So if I were you and your cell phone gets dead, forget about that new fancy smartphone from the young fella who's constantly using it in the bathroom, and get the old clunky phone from that elderly gentleman or woman and use that instead. So you've watched the hands. The next step is to be a real skeptic about treatment. So what do I mean by that? Well, let's look at this. Complementary alternative medicine, homeopathy, naturopathy, all sorts of other treatments. These could be chiropractic manipulations, osteopathy. They could be herbal therapies, food therapies. They're all over the place. And it turns out I'm an ear, nose, and throat specialist, so I'm interested in ear, nose, throat disorders. Active bacterial sinus infections in 3/4 improve with these therapies. If you have a sudden hearing loss, you're going to recover up to 60% of the time just from complementary therapies. Vertigo also recovers. Bell's palsy, a very serious weakness of your face, recovers on its own most of the time with these treatments. And ringing in the ears, also called tinnitus or tinnitus, often improves with these therapies over 5 years. Does that mean you should go out and do these therapies? Are they effective? No. Watch carefully. What we're really seeing here is the natural history and spontaneous resolution. All illness that's non-serious and sometimes even serious problems get better on their own. They really, really do. It's not infrequent as an ear, nose, and throat doctor. I see a patient with a big hole in the eardrum, and I've followed them for years. I've had several cases where when we get to the operating room and I look in the ear, it healed on its own. Incredible. But lots of things get better on their own. So what you have to think about when you see a doctor or any healthcare professional and they do something is the result that happens because of what they did. It may be, it may not be. There's actually another possibility. And we think about this if we focus a little bit on roosters. So roosters are very smart animals. And roosters actually know, or think at least, that they make the sunrise every day. In other words, their intervention leads to the outcome. But this isn't cause and effect. We all know that. It's a sequence in time. It's not causal. But it's hard to tell sometimes what's what. You know, a healthcare encounter occurs, someone does a treatment, and something happens. But there's another possibility. What would have happened anyway? People get better on their own. Natural history, fighting the germs, the virus, the bacteria. Your immune system kicks in. Sometimes things just happen randomly, and a lot of symptoms tend to fluctuate, and there could be times where you see a doctor with bad symptoms, and then it just reverts to a mean state called regression to the mean. Lots of reasons other than treatment why people seem to get better. Here's an example, sinus infections, a very common cause for antibiotics in adults. Here's what happens if you give placebo, a sugar pill, to people with bacterial sinus infections. Not that many get better. By 14, 15 days, it's barely half. But if instead of saying you have to be cured, you're improved, it looks much better. By 7 to 12 days, nearly 3/4 get better from the placebo, a sugar pill. Does that mean antibiotics are useless? Well, in the studies that have looked at this, it turns out that at 7 to 12 days, if you have 73% better with the sugar pill, it rises by 14% to 87% with the antibiotic. So the antibiotic does help, but the effect is small, and most of the improvement is due to natural history. By 14 to 15 days, the effect is not even significant in a statistical way. Here's George Washington. And what does George have to do with this? Well, George made a very important medical decision when he was encamped at Princeton in 1777. And there was a serious problem. The British were actually sending in patients infected with smallpox into the ranks of the Continental Army. And these people would get sick and die. Smallpox was fatal. And it was reaching the point that there were concerns that the entire Continental Army was going to be wiped out by smallpox. So George Washington made an important decision, the most important actually in the Revolutionary War, that was a medical decision. He decided to inoculate, to vaccinate the entire Continental Army with smallpox vaccine. Very risky at the time. Now, there was work being done in England where they would take something from milkmaids. Milkmaids were known to be resistant to smallpox, and a fellow named Edward Jenner noticed that milkmaids were exposed to a cowpox, very similar to smallpox, and it conferred immunity. So Jenner began inoculating with this device here patients so they wouldn't get smallpox, but he used cowpox, not quite as virulent. Washington wasn't aware of this, but he vaccinated his army with actual smallpox from infected individuals. A bit risky, and people sometimes died, but ultimately it conferred immunity, and he literally saved the Army from extinction. Now, did George Washington need a very fancy medical study where they compared all sorts of treatments or randomly looked at things to know that the smallpox vaccine worked? The answer is no. It was dramatic. And we don't always need these fancy randomized studies to tell if something works. Nobody's ever done studies to really see if insulin works for diabetes. The effect is so dramatic, it would be unethical to give someone a sugar pill or a placebo. And sometimes there are changes so dramatic in medicine that we don't need any further studies. For example, some children are born with birthmarks called hemangiomas. They're these big cherry spots that can actually take over the whole face or cause breathing problems. And about 10 years ago, some people accidentally noted that when they gave a blood pressure medicine called propranolol, been around for decades, to these babies, the hemangiomas went away. I mean, dramatic. No one has ever done a randomized study or a comparative study to see if that really is true. It's so dramatic you don't need one. But most things in medicine are less dramatic. They fluctuate a lot. There's a lot of background noise. And without well-designed comparative studies, we simply don't know if a treatment is better than what would have happened anyway. So ask your doctor, what is the level of evidence? Meaning, what's the level of proof behind the treatment you're recommending? At the lowest level, the bottom of the pyramid, is expert opinion. I'm an expert. I think it works. I do a lot of it. My patients get good results. Therefore, you should do it. Not a very sound basis for recommending treatment, because you cannot distinguish natural history, biases, other effects from the true effect of treatment. At the next level, you can move up to what are called unfiltered information, observational studies, randomized studies where you compare things. The best evidence is called systematic review, and that's a process to locate, appraise, and synthesize published research studies, typically randomized trials, to see if they're consistent and really understand the treatment effects. So, to sum up, in part one of this talk, and this is a lovely cake I received from a patient a few years ago in Brooklyn, watch your doctor's hands. If they don't do the right hand hygiene, they don't seem to care about it, think carefully about whether that should be your doctor, especially if you have other chronic conditions that make you susceptible to infections. And second, be a treatment skeptic. Don't assume that because you get better or your doctor tells you someone got better after treatment, it was really because of the treatment. Separate a temporal thing from cause and effect. We're not looking for roosters who make the sunrise here. We're really trying to understand treatment effects. In the second part of this talk, I'll be giving you some advice on why you need to be very cautious about antibiotic prescriptions and why even luminaries and experts need to be taken with a bit of salt. You need to beware of them. So, the last thing, we'll deal with eating right and simple common advice, but I hope you'll join me for the second part of this presentation. Thank you.